You can either be in the business of plastic surgery blindly, or you can really just have a philosophy that we can all turn to. We see that in many companies, that they have a culture and environment that guides us in our decision making. And for us, our value propositions have always been best in class. And we believe that's best in class in how we treat our patients and serve them, being educators for our patients, and then bringing the highest level of results, whether that be non-surgical or surgical with it. And so we really direct all of our behaviors, all of our acquisitions of products or services to our patients with always that in mind. Is this going to bring the highest level of care for our patients? And that's our guiding principle to sort of carry us through when the challenges or the decisions become tough, because there's a lot of products out there, a lot of lasers, a lot of devices, a lot of things to decide between. And so if we use that as the parameter by which we choose, it always leads us in the best direction, which is what's best for our patients to give them that level of service. You know, skincare hasn't really been part of a plastic surgeon's practice for that many years. Really, it started in the late 90s, and I started practicing late 90s, so I kind of came into it just in its infancy when we really only had 2 skincare products at that time. Today, we have many more choices, but fortunately, the choices have actually gotten better. The design of the products have gotten better, and I like the concept of physician-directed skincare that actually works. And so I had Neocutis for a time in the practice, but because there were so many growing product lines, you have to start dividing out how much you really want to offer to your patients, because our message gets very diluted and mixed if we didn't. But Neocutis upgraded and really had an upgrade to their product line, so much so that we really wanted that to be one of our leading growth factor skincare lines for it. It was really delivering better results. It was being the most modern of a skincare product line for us. And so I always look at each one equally, and even though we'd had it before, once they had something new to offer and it was going to be a more advanced line, then I thought it had a perfect place in CaloSpa, and so we brought it back into the fold. So Selfina has been great for the practice. I saw it when it was in its initial prototypes and they asked me to look at it, and I liked the idea, but it really developed so much more from that point a few years ago. And they'd really had some clinical studies, and some of my associates and colleagues around the country who I talked to were doing some of the studies for the company, and they were really starting to see results. We'd had some other treatments like cellulase and other ones that I didn't find particularly helpful or beneficial all the time. But Selfina was actually delivering the results for the right type of cellulite, where you have definitely small defects, where you have small defects and deficits, dimpling. It actually works, and it really works almost all of the time. And that's hard to talk about cellulite and say anything is most, if not all of the time. So for the right cellulite, it really, really works, and it usually works with one treatment. What I love about Ultherapy right now is that they really brought the science to play. It is exact, and when you're heating up the skin and soft tissue under the skin, you're actually heating up exactly where you want it to. So it's ultrasound guided for the heating, and I like the precision which it delivers. It delivers a no downtime recovery and really minimal risks, and with more efficacious results. The results are proven to be better and expected with each patient. Whether we're treating the neck or the décolleté, we have different levels. We can heat the dermis and heat the tissue in order to get the lifting effect or help the texture. So I like its versatility and its no downtime. And in the past, Ultherapy, because we were trying to heat tissue, but doing it sort of globally, and we weren't really selecting it, it was more painful. Today, because we precisely know where to put the energy and heat it, it's become a much more comfortable procedure for our patients. I've done injectables for 21 years. So back in the late 90s, in 1997, I brought toxins into the practice because I was using them in California. And so I was familiar with them, and they weren't really familiar in the Midwest at that point in time. So, and then we had so many iterations of types of fillers we were using, collagen-based products, but you know, by the time the swelling went away, so did the results. So we've tried to bring on the different toxins that they were available, and the Xeomin not being any different. It's a toxin that's reliable, it actually works. Its simplicity in transferring our techniques from the past to the future with Xeomin has been good. And I've always been a Radiesse fan, because Radiesse is a calcium hydroxyapatite, and it gives us lift to the tissue. You get a lot more for your money, so to speak, with Radiesse because you get 1.5 cc's and it actually stays there, so you can actually fill and lift tissue reliably. So it's my go-to. For me, when I'm filling in the nasolabial folds, especially in men or where it's heavier, I find Radiesse is almost like building up the bone and sort of building up the tissue and structurally. Right. And I've used it for the last decade. Merz has changed, like every company has changed, and I've gotten to know so many reps who sometimes go from one company to the other, but you know, my relationship with the reps always maintains no matter what. And like all companies, if you're there long enough, you go through a lot of transitions. But what's been really nice is I've really seen in the last couple of years a real cultural change in Merz. And I mean, it's really become a company that you want to work with. You find reasons to work with them, both at the level of our reps, but also at the level of management, you know, with Bob Radigan and others that are there that are really leading it in a direction that I've worked with these leaders before, and they've taken companies to the place we want them to be. Customer focused both on the patient and patient safety, but also focused on the customer, being the plastic surgeon, the dermatologist, to work and partner with them to find a path for bringing their technology or their products into the practice, whatever that be. And you know, we've gone through that recently with Merz and really saying, we need to find a path. We want these products. Can we find that path and that reason to bring them in? And we always work it out, whether it be with Neocutis, it be with Xeomin, or it be all therapy. We bring all these technologies in, and it's only because Merz works with us to make sure that makes that possible.
And then as you sort of progress through your life, you're always looking for things, sort of what's next? What's the next level? And for me, to go into plastic surgery just made sense. I grew up around general surgeons. I didn't really want to do what they did. And then sort of having an artistic side to me, that sort of drew me to the field of plastic surgery. Then once you decide what you want to do in life, you find mentors that sort of guide you through that level. And fortunately for me, my mentor actually is who I'm in practice with now, is Dr. Calobrace. When you see companies that are sort of have these broad portfolio of products that it's not just an injectable, it's not just skincare, it's not just devices, they have it all. You want to incorporate that with what you're doing, because we're about sort of results-driven practice, and we want to see results. We don't use things that don't have results. There's a lot of technology we bring in, there's a lot of technology we get rid of because it doesn't have the results. But partnering with Merz, like before I came to Kentucky and Rochester, New York, I had partnered with Merz in my training, so they brought their products in to me as a young resident, which was very smart for them, because they knew as I became a plastic surgeon, moving away from New York, going to a different practice, that I might use their products. And when I got here, knowing that Merz was a part of this practice, it was very comforting to me, knowing that this company that's been around for a long time, that I was familiar with when I was in New York, it only made sense when I came back to Kentucky to still use their products. And their portfolio, there's just such a wide variety. It's been nice to be able to offer those options to our patients, from skincare to injectables, and then from cellulite treatment with Selfina, and now the therapy for the ultrasound for the face and neck areas that are non-surgical. As a plastic surgeon, obviously I like to do surgery, but if you can tailor your treatment to those patients that don't want surgery, it only makes sense to use a company like Merz. I've been using Xeomin for, I guess, 8 years. So 8 years ago, I've mentioned Rochester, New York, that's where I did my plastic surgery training. We use Xeomin all the time. I was very comfortable with it. I was very happy with it. Then I came back to Kentucky, and that was something that wasn't being offered at the time, and I was a huge proponent about bringing that back to the practice because I saw the effects of it. I thought it stood right up there with the Botox. I didn't see any difference, and that's, people will come in like, oh, I want Botox, and they don't realize there's other options. It's sort of like Kleenex, Q-tip. It's just, they call that one thing, one name, whereas there's so many options that fall into that. And Xeomin is nice for our staff because the conversion in units is very similar to some things we've already used, so it takes out that confusion. But the results of it are right up there with the other competitors in the market, so I'm very happy to be able to use it. Having the Merz portfolio of options here in the practice, I can, you know, instead of walking down this surgery pathway, I can take them down this non-surgical pathway. If they come in for a facelift and I realize, oh, they don't have the downtime built into their lifestyle right now, they're a busy professional, can't take a few days off to come in for that treatment or come in for surgery for 4 weeks of downtime, then I walk them down this non-surgical pathway. Something like Ulthera is great for that. There's no downtime with it. So they come into me and I'm like, you don't really have that surgery downtime built in, let's go this non-invasive pathway. And then if they are a surgical patient, I like to stack things that are going to help me get the best surgical outcome. So that once I complete their surgery, there's things I can do before surgery, or there's things I can do after surgery. So if you're going to operate on the face, you want the best possible skin that you're going to be lifting and tightening. If you have beat up leather, it's not going to do as well as fine, new, crisp leather. So using something like Neocutis to sort of get the facelift patients ready for their operation weeks ahead of time, do your procedure, get the best surgical outcome surgically, and then post-operatively use the Neocutis line to help them with their skincare is only going to help you as a plastic surgeon get the best results. So it's not just the one thing, you have to have all those options available.
Merz has a lot of great products and procedures that we use frequently. I'm the primary provider for Selfina, and I love that treatment. It's a great one-time treatment for cellulite, and really before Selfina, nothing else targeted that kind of cellulite, and so it's fun to see. Patients are so excited. I mean, it's a life changer.
What's great about our practice is that we have a very set algorithm for how we treat patients. So whether it starts off with me, or it starts off with Bethany, or they start off with Dr. Calobrace, we're able to give them a systematic treatment plan where if I'm not the provider for them, then I can send them off to Bethany, or I can send them off to the surgery side. I think what's really great now for me with my consultations is that there was only certain devices that we could utilize for superficial textural irregularities. So when I would have patients come in to see me that had deeper dimpling, there was nothing to address that in the past. So when Selfina came around, it was extremely revolutionary because we've never seen a technology like that before in the aesthetic industry. So when we got that device here, it was nice. So I was able to say to a patient, there is an answer for you, and we're able to get you an approach that is going to be successful.
So we've known Rhett for many years, and he was just having a regular injectable lunch, and he approached me wanting to possibly talk about Neocutis and maybe bring it back into the practice because we did recently have it before. So he introduced me and the staff and Dr. Calobrace to Matt and Meredith, and they brought in and discussed the newer line, the MPC line with Neocutis. And Dr. Calobrace was very impressed with it, and he thought that it would be a great addition to the skincare that we had. And we even had a launch party for all of our patients just to see how it would do. And it was a huge success. So at that point we decided to expand it and bring on the PSP line, and now we have the full line of Neocutis. It's doing really well. Dr. Calobrace even features it with his facelifts. So every patient that has a facelift with Dr. Calobrace or Dr. Mace gets a complete regimen of the Neocutis MPC line.
I got into the aesthetics end of things and worked for another plastic surgeon for a couple of years, and then was just thrilled when I was able to work for Dr. Calobrace. He's an amazing man, and I've watched him grow. When I first started with him, there were 8 people in the practice, and now we have over 50, and obviously 2 physicians with Dr. Mays. And you know, even though we've grown and we've become this bigger facility, it still feels like home. You know, hopefully I know that it feels like that for me, and it's a very family-oriented place to work, somewhat also like Merz. So I think that's why we work really well together. And it's also, I think, a good feeling for our patients. You know, even those that have been with us all these years, I think it still feels like home when they come in the door. But being that we're larger and the practice that we are today, we're able to offer so much more for our patients. So we can follow them through whatever their needs are. And we're able to do that too with a lot of the technology that Merz has available for us to use.